When it comes to protective face masks like this one, an expert for infectious diseases here at Dayton Children's says guidelines are changing all the time.
We are learning, it seems to me, literally something new every day, something that will improve the diagnosis, the care, the prevention of it.
According to Dr. Alter, it's a myth that face masks are an excuse to ignore other recommendations for preventing coronavirus.
He has to realize that if you have a mask on, it doesn't mean you can gather in large groups or, meet all other people very closely.
Dr. Alter also says it's a myth that N95 masks should be used by the general public.
If I'm caring for a person that would have COVID-19 coronavirus infection, and I might generate an aerosol of spray, then I probably need to wear an N95 mask. Walking in public, even encounters in a supermarket or a pharmacy, doesn't necessitate that you and I wear an N95 mask, and I would not wear it.
Another myth, according to Dr. Alter, is that only sick individuals with symptoms of COVID-19 should mask up.
I cannot control the possibility of individuals coming within 6 feet of me. I think that a healthy person should wear a mask in public. The most important thing is trying to distance yourself from other individuals, also realizing that there may be some spread from persons that don't have symptoms.
According to Dr. Alter, face masks should not be put on children under the age of 2 or handicapped individuals. I'll explain more and give you other do's and don'ts coming up on 5 on 2. But for now, in Dayton, Aaliyah Williamson, 2 News, working for you.